Tom, you mentioned local, state, and federal policy on this topic. Michelle, Tom, any comments about what's evolving? Are there going to be public policy motivations to develop CRPs, or what are we looking at?
Well, I think we've seen quite a few already. A few states have taken the initiative to adopt or strengthen laws protecting statements of apology and explanation after medical error, which, although not necessary, is helpful sometimes in persuading physicians that it's safe to apologize. And more recently, in Oregon, they've gone a step farther and actually created a program through which the state can support and facilitate mediation in the context of voluntary CRP programs.
And Tom, is there some work going on in Washington state, particularly around physician issues?
Well, at the state level, there are a number of exciting developments. CRPs coexist with state regulators like boards of medicine, which is really an important tool that the public has to oversee and monitor the quality of care. CRPs have presented a real challenge for state boards of medicine because they rely heavily on concepts of just culture and trying to understand system failure, human error, and distinguish it from cases where provider competence was the problem. And so there's a lot of exciting work going on with state boards of medicine to help them be a part of CRP processes while strengthening the tools that exist. Provider competence is not nearly as much of a problem as some consumer groups would suspect, but I think it's more of a problem than the profession has been willing to admit up to this point. So I see these two streams developing in tandem: public support for CRPs, but also encouragement to develop better programs to identify clinicians who are struggling and help them provide safe care.